Hello everyone, Dr. Suneel Dhand, internal medicine physician. The World Health Organization made a statement, a very recent statement, and one part of it caught my attention regarding countries not relying solely on COVID-19 vaccine status to let people in. The link is down below to the full statement. Let's dive in. Statement on the 10th meeting of the International Health Regulations Emergency Committee regarding the coronavirus pandemic. This is from the 19th of January. The committee discussed key issues including the following, and then they listed a set of temporary recommendations to states parties. I presume states parties means countries. Firstly, continue to use evidence-informed public health and social measures, therapeutics, diagnostics, and vaccines for COVID-19, and to share response experiences with the World Health Organization. I'm very glad that they also mentioned therapeutics. I don't think anywhere near enough attention has been focused on therapeutics over the last couple of years, which is kind of the core fundamental of what we do in medicine is we provide therapeutics, and it's astonishing that we haven't been talking as much about that. So I'm glad the World Health Organization did mention that in this statement. Then take a risk-based approach to mass gathering events by evaluating, mitigating, and communicating risks. That seems like common sense. Achieve the World Health Organization call to have at least 70% of all countries' populations vaccinated by the start of July 2022. I think that will be a tall order for many countries, many poorer countries in Africa and Asia that still have very low vaccination rates and actually have great trouble affording the expensive vaccines at their current prices. Enhance surveillance of COVID-19 and continue to report to the World Health Organization to enable rapid identification, tracking, and evaluation of variants. Countries should ensure that there is sufficient surge capacity for critical COVID-19 clinical care and post-COVID-19 condition and for the maintenance of essential health services, and should plan for the restoration of health services at all levels with sufficient funding, supplies, and human resources. That is another area that I feel particularly strongly about. How often over the last couple of years have you heard healthcare leaders make statements saying something like, yes, we know COVID-19 is there, we know we will get local surges, and we will invest in our healthcare system. We will have more hospital beds, we will invest in more staff so that we are not overwhelmed. Basic stuff here when you know you're in a pandemic situation. And why, oh why, have healthcare leaders not done this very basic thing? Lift or ease international traffic bans as they do not provide added value and continue to contribute to the economic and social stress experienced by countries. Then there's this one, do not require proof of vaccination against COVID-19 for international travel as the only pathway or condition permitting international travel, given the limited global access and inequitable distribution of COVID-19 vaccines. Countries should consider a risk-based approach to the facilitation of international travel by lifting or modifying measures such as testing and/or quarantine requirements when appropriate in accordance with the World Health Organization guidance. So we'll come to that more in a moment. The WHO recommendation for countries to not solely rely on proof of COVID-19 vaccination for international travel. Recognize all vaccines that have received WHO emergency use authorization. Address community engagement and communications gaps and challenges posed by infodemics at national and local levels. Support timely uptake and monitoring of recommended therapeutics. Conduct epidemiological investigations of COVID transmission at the human-animal interface and targeted surveillance on potential animal hosts and reservoirs. I haven't the foggiest idea what that last point means regarding targeting animals and animal hosts, because animal reservoirs are basically unlimited, and we've already seen COVID-19 in many different wild animals. How can you possibly control this? It is basically an impossible task. But let's get back to this COVID-19 vaccination for international travel statement about not relying on it as a sole means of admitting people into a country. I wonder again what US big tech is going to think of this statement. Is US big tech actually going to censor the World Health Organization now? Wouldn't that be something? That would mean we have come full circle here. These people are a metaphorical circular firing squad. Total idiots. When I say idiots, I am talking about US big tech. The World Health Organization, I'll come to them at a later date. They've also made mistakes. But for this purpose, the idiots I'm referring to are US big tech who randomly censor stuff, and wouldn't surprise me at all if they now censor the World Health Organization. So let's think about this. Every country in the world has their own COVID-19 entry requirement rules. That is their right, any country's right as sovereign countries. Many countries in the world have chosen to have COVID-19 vaccine requirements in order for anyone to enter their country, and there seem to be very few exceptions for certain countries. So let's ask these questions then. Number one, if you are going to have vaccination requirements for entry into a country, what are the true public health goals? Especially as many of these countries already require people to test for COVID-19. What are the true health goals? Then let's think about this. If COVID-19 vaccine passports are going to be used for international travel, or indeed anything, I brought up this point before, but surely they would only work if you require regular boosters. I'm not saying I agree with that, but if authorities themselves are saying that the immunity from COVID-19 vaccines wanes over a few months, then what use would a vaccine passport be from years earlier? And I'm thinking ahead here. You show up in a couple of years with a vaccination proof from 2021, beginning of 2021. What is that actually proving? So what use is a COVID vaccine passport if you are not going to require regular boosters? Then let's think about this. There may be certain people in any country who, for whatever reason, can't have COVID-19 vaccines. It may be their medical history, perhaps they have certain allergies, perhaps they had a certain reaction to the first shot, who knows? But the issue is there will be certain people, and the problem with COVID-19 vaccine requirements for countries is that it's almost impossible to get exemptions. So there may be a segment of the population who cannot travel internationally. Will that be fair? So as the World Health Organization said, and they may have said this for other reasons, but they brought up such a good point to not solely rely on COVID-19 vaccines to allow people entry into a country. Finally, I'd like to leave you with this thought that I heard put very well online recently. For some time now, it has been a requirement for international travel to be vaccinated. That has simply been the case. What has happened over the last 6 weeks or so? We have seen the rampant spread of the Omicron variant of COVID-19 all over the world. It hasn't spared any countries. So if mainly vaccinated people are traveling, I think it's a bit of a stretch to say only unvaccinated babies, toddlers have been spreading COVID-19. It's quite obvious that you can spread COVID-19 no matter your vaccination status. What use practically is a COVID-19 vaccine passport with everything we've seen with Omicron over the last 6 weeks or so? It's spread to every country despite the fact that mainly vaccinated people are the ones traveling. That is something to think about on a practical standpoint. I'm somebody who has traveled all over the world pre-COVID. I've been to every continent, and I don't recall ever being asked to show proof of vaccination status for any illness in order to enter a country. I do not believe that has ever happened to me. So we really are in new territory here with vaccination requirements for international travel. Let me know your thoughts then down below. This statement from the World Health Organization on not relying solely on COVID-19 vaccination status as a way for international travelers to enter any country. Again, the World Health Organization may have been saying this for a different reason, but I think they hit upon a very important point. Do COVID-19 vaccine passports from a true public health perspective, when travelers right now anyway are already testing for COVID, are they serving any purpose or are they merely for show? Thanks everyone for listening. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. Have a great weekend. We'll speak again very soon.